Welcome to this week's episode of Promising Young Surgeon. This week, Dr. Philip Sossenheimer joins us to discuss his work as a leader for the Stanford Residency unionization efforts. Today, we'll begin with just an introduction to resident unions. The Committee of Interns and Residents, CIR, is the largest house staff union in the U.S. It represents over 32,000 residents and fellows in California, Florida, Idaho, Illinois, Massachusetts, New Jersey, New Mexico, New York, Vermont, Washington, and Washington, D.C. In their own words, CIR unites and empowers resident physicians to have a stronger voice within their hospitals. They garner more negotiating power and support for their patients and communities. CIR is democratically run with elected house staff from around the country. Their issues include resident well-being, immigration, health justice, reproductive justice, racial justice, gun violence, and public health. Goals of the CIR are to take care of residents and fellows with improved wages and salary, having a real voice on the job, unique training, and career advancement. Another item that's highlighted is taking care of patients with physician-community partnerships, defending patient care funds, and providing services for patients in high-need communities. And finally, to raise the standards of residency everywhere with legal protection and due process at work, holding educational organizations like ACGME and ABMS accountable, and providing templates for enhanced contracts and structures to enforce them. There is a Stanford House Staff Union that is partnered with CIR, just to give a little background for today's conversation and guest. I do want to share this quote from a 2023 Stanford Daily article that quotes OB-GYN resident Dr. Kaur. Across the country, residents and fellows are treated as unlimited resources. But the idea of a, quote, healthcare hero is a myth that perpetuates exploitation and abuse. Dr. Philip Sossenheimer is a Stanford Palliative Care Fellow and graduate from Stanford Internal Medicine Residency and the University of Chicago Pritzker Medical School. He led trainee unionization efforts at Stanford during his internal medicine residency, and he's a musician playing upright bass in a jazz band. He's also a big fan of dogs, and his dog, Cashew, joins us in attendance today. Thank you so much for being here, Philip.
Yeah, thank you so much for having me. I'm thrilled.
So let's just jump right into it. In 2020, Stanford Healthcare initially excluded residents from eligibility for the first round of COVID-19 vaccines, which was reportedly a breaking point for resident physicians. What was that like being there in real time, and what effect do you feel that it had on the resident workforce?
Yeah, I think this is something that in some form or another, all of us have experienced in residency, and all of us experienced during the pandemic as well, which is having a realization that, the health system, especially for those of us who are residents and fellows, but I think for all healthcare workers in general, often we feel that the health system doesn't value us much. And I think particularly for residents and fellows, there are times in our training where we realize that we are in some ways, that management don't understand our role, that they don't really, think about us or recognize the important role that we serve for the hospitals that we work in. And that's always been true, for a long time. I speak to some of my attendings who felt this way 20 years ago before the pandemic, that you're working long shifts, getting paid very little, and the people in the C-suite probably have no idea who you are or what you do, But that really boiled over during the pandemic. And at Stanford, the area that we recognized it was when, like you said, we were excluded from vaccination. I think of the 1,500 house staff, only 5 to 7 were included in the first wave of vaccines. This includes, all of the anesthesiology residents who are intubating COVID patients in the ICU, all of the ER residents who are doing the same in the ER, myself, who was on COVID wards and working COVID MICU shifts as an intern. Stanford, for their part, says that it was an oversight in the way that they allocated, that it was an algorithmic mistake. Whether it was an intentional exclusion or not is beside the point, because I think what it made us realize is that these people who are making the decisions at the higher level have no idea who we are. There's nobody effectively advocating for us at the decision-making level. And in that sense, it makes us feel that we're kind of viewed as expendable. We're just bodies that can staff the hospital, and we're very cheap ones at that. So that was the first thing that we realized. And I know many people in healthcare had similar realizations for a variety of reasons, whether it be access to PPE or being required to work extra long shifts. A lot of people, I think, during the pandemic began to feel expendable.
Yeah, I agree. That's such an extreme and kind of systems-based issue. So I can definitely see why that boiled over. But, to kind of even talk about a little bit of my experience, I agree with you that moment of disillusionment is probably pretty universal for a lot of resident physicians and fellows. And my example is honestly not even really pandemic related because, we experienced basically just a lot of pressure to make the attendings' lives as easy and smooth as possible. And kind of in return for very little teaching. And if that wasn't done, then we were really treated like we had failed at the task. And so that's where you start to see, especially with surgical residents, they're just standing nervously at the board, trying to get cases to run sooner than they are. I've personally rolled patients myself from their room into the operating room just to make it happen faster. Not necessarily because it has to happen faster, but because one of my bosses wants it to happen faster. You know what I mean? And that's a kind of cultural way where you just start to look around and say, who was this system built for? Definitely not to teach residents, or provide clinical vigorous education. So
yeah, I think it's interesting because, and we'll get to this later, I'm sure, but during our contract negotiations, the representative of Stanford who was negotiating with us told us that, we were already overcompensated because we should factor in the free tuition, quote unquote, that we get. And I mean, first off, what an insulting thing to say to somebody who's already finished their degree, and like you said, whose quote unquote training is mostly on the job. But there's a couple salient points that I think I realized, which is that, I don't know, 80%, 70 to 80% of the things that I learned in residency were taught to me by other residents, or fellows. The teaching sessions on rounds, the chalk talks, after rounds, morning report, all of these are things that are done almost always by other residents and fellows. And occasionally I would have a good attending who would make an effort to teach and do formal teaching. But a lot of the time, it's residents teaching other residents. And so it just is a little bit silly to say that we're receiving this great tuition-free education when we're also the ones who are giving it. You know what I mean? If anything, they should be paying us because we're teaching the med students
educating yourselves. Yeah, right.
Totally. Educating ourselves, educating med students. And then the other thing that I thought was really interesting is that, the teachings that we get are open to any member of the team, right? So on MICU, we might have a noon conference, and anybody who's on MICU can come to the noon conference. And that includes residents and fellows. It also includes attendings who might be there. It also includes nurse practitioners and physician's assistants. And that's great because we should encourage a culture of lifelong learning where everybody can, the evidence is always changing in medicine. We should always be learning and educating one another. But for some reason, it's only residents and fellows whose attendance at those educational sessions is then held against them in terms of their total compensation. My MICU fellow teaches me how to do central lines. He also is teaching the nurse practitioner who's been newly hired on to do central lines. But only one of us is being paid well below market rate. Although, probably the nurse practitioners are generating more revenue for the hospital than they're getting paid. But they're getting paid substantially better than we are, and no one's telling them that they're receiving tuition-free education.
Well, I'd love to hear that conversation. I'm just fantasizing now about somebody telling the attendings, we are going to dock your pay, $100,000, but you do get those free MICU lunch lectures.
Exactly,
so the tuition free, you're making up for it. And just,
I know.
Yeah. That's hilarious to think about.
And the thing that I just want to reframe here too is that, and I know everybody's experience is different, and there are absolutely attendings and people in positions of power who have abused residents and taken advantage of them. And most of the attendings that I've worked with, an overwhelming majority of the ones that I've personally worked with, have good faith. They want to do the right thing, and they're also super overworked. I'm in ONC clinic with an attending who has over 24 patients scheduled in a day. And that system is not. There's no way that person can make that happen without exploiting residents. It's just physically not possible to see that many patients. And it's certainly not possible to do so in a way that's empathetic, compassionate, that allows the patients the time and space that they need to talk about and deal with these really heavy issues. And so it's not just the attendings taking advantage of the residents. It's also the fact that we are all in a system, the attendings included, where, we're expected to do too much with too little. And so it's unfortunately, those are the types of conditions where exploitation, abuse, all of those negative things arise. So yeah, it's a structural issue. And that's why I am a big fan of structural solutions,
That's so well said. No, and I definitely agree. I wanted to bring up that I loved one of your quotes from the Stanford Daily interview that they published in May of 2023. You said that successfully negotiating a labor contract would, quote, set the standard for residency and fellowship for the rest of the profession. And, quote, you said, this is an opportunity for Stanford, one of the wealthiest and most prestigious healthcare systems in the whole world, to invest in its frontline healthcare workers so we can take care of our community. We are fighting for a healthcare system that values people over profits, and we refuse to settle for less. So I'd love to use that to kind of launch into, your experience with the Stanford unionization efforts, how it began, and then, of course, the outcome.
Yeah. So, it began around the time of the vaccine rollout, and it didn't start as a formal effort to unionize. What it started with was just collective action. And when we think about, when people talk about union this, union that, I think it's important to talk about what we mean, right? And some people are, our health systems, our employers, in my experience with Stanford, is that the health systems try to spin unionization. Oh, there's going to be this third party, this union that's going to be representing you. So what we're talking about is just collective action, right? It's all of us who have shared interests and aligned priorities getting together and doing something to make it happen, right? So in the instance of the vaccine rollout, which is what I view as the start of our unionization campaign, even though it wasn't a union campaign at first, is we organized a protest, and we had a collective action where a couple hundred residents and fellows walked out over lunch into the main auditorium of one of the Stanford hospitals and demanded that we be offered vaccination, just like other frontline healthcare workers. And our stance is that all people who are working frontline, environmental services, residents, nurses, whoever it is, hospital techs, they should all be first in line for vaccines over people who are working from home. And that was not the case. And so the first thing that I said that we realized was, that the C-suite wasn't thinking about us and making decisions. So we had to do it ourselves with the protest. But the second thing we realized is that collective action can be extremely powerful, because within 24 hours of us having a collective walkout, having media coverage on it, Stanford had reversed course and fellows and residents were eligible to get vaccination. So I think that was sort of a level up in everybody's consciousness as a resident and fellow, where I think the system is designed to make us feel isolated, make us keep our heads down. The way that you get ahead in residency in academic medicine in general is by being a little bit subservient to authority. That's the perception that people have, right? If I just work the extra shift and don't say something when my attending is inappropriate, then maybe I'll be able to get a fellowship. Maybe I'll be able to get a job. The types of people that medicine trains are people who are fairly deferential to authority, in my experience, because that's sort of the hierarchical system of medical training and medical school and becoming an intern and then a resident and then attending. It's very structured that way. But what we realized is that, in our collective action, we can stand up for injustice and do so in a way where we are all together, where we can't be singled out, and we can really make change happen. So that's where the unionization effort then was born out of. A key group of folks who'd helped organize that protest began to do sort of an organizing campaign with the Committee of Interns and Residents, which is the union that we joined. I don't know how much you want me to get into the logistics, but
that's perfect. Well, I mean, I do want to kind of echo what you're saying. I remember I was in Missouri at the time, and I saw all of those efforts in the news. I remember seeing the Stanford protests in the news in response to, the way that the vaccines were rolled out. So definitely agree with you in terms of, what a major news cycle impact and national impact it had.
Yeah.
In terms of how many, I guess one question I have, I'd love to hear, any of the logistics in terms of a lot of us, especially a lot of us who train in totally non-union institutions. We have curiosity. How many residents and fellows were involved in leading that group? Because you described several hundred in the collective action. But what was kind of the structure of, the seed getting planted there?
Yeah, I'll tell you, it was, there were many times where it was a pretty small number of people. And I'll say, the reason when people ask me what the downside of unionization is, honestly, the biggest downside is that it is a lot of work for the people who are organizing. And for a group of residents and fellows who are already working a lot and already burnt out, it's a big ask to organize 1,500 folks, to sign union cards, do all the education on what unionization means. So, there were 300 people at the protest, but I think our organizing committee, the core people who were involved from the beginning was, on average, like 10 people, 10 to 20. There'd be more people in our groups, like we had WhatsApp groups where we would coordinate. But because people have late shifts, they're working, there were, never more than, I think, 20 people in one of those core organizing meetings at a time. And sometimes, and for some of our meetings, there'd only be, 5 to 10 people there because other folks were busy. So I think the thing that I want people to understand from that, though, is that you can do a lot with a small group of people, a lot, because that's the core organizing group. But the number of people who we had who supported the effort is way higher. It's just that you have to combat their apathy, their sense of hopelessness, their sense of fear, their confusion. These are the tools that the employer will use to organize against you. They're going to sow fear by telling folks that, the union is a third party. The union you're not going to be able to protect your benefits. You might get less. They're going to try to sow confusion by, misrepresenting what unionization means, by being opaque in the messaging. And they rely on people's apathy and saying that, well, the system's not going to get better. I don't really have an impact. I'm going to graduate in 3 years anyway. So what's the point? But if there's a group of 5 to 10 people who can work hard to reach out, have these conversations at lunch, have these conversations in the workroom, recruit friends just to send out some text messages to sign up folks to union cards, then you can make a lot happen, even with a small group of organizers. Because our membership, our support is over 80%. We won our election with over 80% support. Yeah.
Wonderful.
It's just that it's really hard to get people to commit to doing 10 hours of extra work a week. You know what I mean?
Exactly. Yes. I did read in your interview about how you were putting at least 10 hours a week towards these unionization efforts and your work. So again, of course, thank you for all the work that you did, but I want to dig deeper into even one of the pieces you just said, which is that part of the battle is that a lot of residents, they are leaving in 3 years. The institutions kind of have this benefit, almost like this secret weapon, which is the revolving door of trainees, like the revolving door of residents and fellows, because, at the end of the day, a couple years from now, the residents will be gone. The institution, the house kind of wins every time in that sense. And so what I think is so important, I would love to hear from you, how can we convince people to put anything even near 10 hours a week towards an effort, which, yes, it's meaningful, but it may not directly benefit them because they may be gone by the time that they see the fruits of that, quote unquote,
Absolutely. I mean, I think this is the heart of any organizing anywhere. which is, first off, you're not doing it for yourself. You know, if you're going to be organizing a new union, just like myself, you know, I'm graduating in 2 months. We just signed our contract 3 months ago. So the vast majority of these benefits I will not personally enjoy. But you do it because it's the right thing to do. And you do it for other people, right? And I think you have to, as an organizer, have the long-term vision and have the dream, you know, about how things could look differently, and recognize that the time scales of change are long, right? And that this process will take a long time. It will take longer than you are in the system for, you know. Residency is the same that it was when I started today. You know what I mean? We have not fundamentally changed the relationship between house staff and our employers, especially on a systemic scale, on a nationwide scale. But we've started that process, you know. One of the things that gives me a lot of hope, and this is one of the reasons that I think unions are so powerful, is that in this specific instance, they offer a structure for that type of longitudinal change to happen, even as leaders turn over, you know, even as residents graduate. There is now a structure for incoming interns to learn from the outgoing residents on how to organize, to be tapped into a national resource, the Committee of Interns and Residents, in this case, our union, to be tapped into a national resource to support them in that effort, and to hold those long-term priorities and values and goals, and bring people in to continue that work, even as other people leave. You know, if we want to have change over the long term, we have to think about building structures that will support that effort even after we are gone, and will allow other people to come in and take up that mantle, you know. And I think I went to the convention last year for the National Union, the Committee of Interns and Residents, and it was really inspiring to see, because there's this infrastructure, there's a framework for thinking about big picture problems in the long term. There's a framework for training incoming house staff to become leaders, to contribute a little bit to that long-term vision, and then to bring other people up and train them how to do it once they're leaving. And I feel that we are fools not to take advantage of that framework. You know, there are many ways that we can change residency, many ways that we can make this practice of medicine better and more holistic, and I support all of them. And unions are a federally protected way for us to organize. They're a federally protected way for us to do so, not just in one hospital, but also across hospitals through a national union, where we can start to think about bigger picture things and how we can move residency to a more positive direction for everybody. So I think we'd be fools not to take advantage of that. And I hope that's what the medical profession writ large is realizing, because I think that this is just as true for attendings as it is for house staff, although I know the focus is on house staff. But a lot of the same problems that house staff face, attendings face in different ways. And I think we as a profession are foolish if we don't use a form of organizing that is available to us and is federally protected. So yeah, I think, you know, what I tell people, just to get back to your question, is you have to do it for the long term. You're not doing it for yourself. And a lot of people aren't going to do that, but there are a lot of people who will. You know, I've, just like you said, you know, in the past couple of years, and since our unionization effort, I feel like we were really lucky that we were one of the first in this new wave, but we're also following the folks at UCSF and the folks in New York and folks across the country who've unionized in the past. And now we're seeing a new wave, right? I know Penn, Northwestern, MGH, Brigham, University of Chicago, GW are all either recently finishing their unionization efforts or starting them. And it's really exciting to me to think about, you know. I think over 80% of house staff in California are now represented by the Committee of Interns and Residents. And if you think about what that type of power could accomplish, it's really exciting for actual structural big picture change.
Very well said. You know, the time scales of change are definitely longer than any person's residency, like neurosurgeons included. So
neurosurgeons included.
The fact that neurosurgeons included. And so the fact that there is kind of this existing framework, you know, the handbook and the wisdom that can be passed down, that's really something. Like, I think that's very powerful. And I definitely, you know, I hope that more and more institutions, like again, at my institution, there weren't even whispers of this. And I think a lot of us not knowing anyone who had done it and not having it at the forefront of our mind, and also being pretty beaten down by the daily work, I just kind of think it would have been awesome to know about these tools. And certainly, I mean, I'd do things differently if I could turn the clock back like 6 years or so. But it's not too late for any of these institutions to kind of get on the bandwagon here.
One last thing, which is, you're reflecting on sort of what will any individual get out of this, because they might not see the benefits, right, from the contract if they're organizing and they're going to be graduating in a couple of years. But the reality is, I think you get a lot of hard skills in this work too. You learn how to organize, you learn how to interact with hospital administration, work on contracts, you get connected with politics. So I think of it as also a skill building thing. This has been a part of my residency education in organizing. And people do research projects, people do med ed. My hope would be that people start to view organizing, being politically active in a sense, as a valid path for medical education as part of their postgraduate training, because there's a lot that people can learn. And I think it would benefit our profession immensely to have more people who are trained in organizing, in political advocacy, because our profession historically has not been particularly good at that, except when it comes to protecting our own, you know what I mean?
Scope of practice. Yeah.
Yeah, exactly. Yeah.
Yeah, I totally agree. And so when you guys did unionize at Stanford successfully, what concretely or effectively did that change? Like, I did read about things like a 21% across the board pay increase, some additional benefits. Like, can you go into any details of that?
Sure. So I'll say, your question was when we unionized, what concretely changed? And I think the most important thing that concretely changed immediately when we unionized is that we get to start collective bargaining, right? And that might not sound like a lot, but I think for the hospital, they know that is the biggest change. Even before you have a contract in place, once you have a successfully unionized, you have fundamentally changed the power structure within the hospital. Before the union, all of us just get a contract handed to us. We have no ability to negotiate it whatsoever. We have no power, right? Now, with the union, even before we had a contract in place, we have federal law that requires our employer to negotiate with us. So we got to have meetings with Stanford Hospital leadership to negotiate our contract. And the thing is, that is a big, big change in the power structure. And that's the reason that the hospitals are fighting so hard against unionization. So I think that's the foundational thing. And people need to recognize that unionization in and of itself is a big victory because it creates that opportunity for change. And these contract negotiations happen every 3 years. Okay. So I think a lot of people, at different hospitals, one of the things that I want them to realize is that even if you unionize and then struggle with your first contract, maybe you don't get a great first contract for whatever reason, you don't have the support, you don't have the power, you still have the opportunity to come back 3 years later, 3 years after that, 3 years after that, to renegotiate that contract. And so what you've done is built up a structure and a system, change the power within the hospital itself so that future house staff can come and continue to advocate and to continue to negotiate. So I think that's the foundational thing. And that's the most important thing, because without it, you're not negotiating at all. So being able to do that is the most important power difference. At Stanford ourselves, in terms of what we actually got in the contract, I think the headline that you read, the 21% across the board total compensation increase, that's, the flashiest. And I think for a lot of our members who are living in the Bay Area and struggling to afford rent, struggling to afford childcare, that is one of the things that they care the most about, because that's the thing that will actually let them to continue to work, without having to worry about finances. And so that money was split between a lot of different things. We had an increase in our housing stipend, we got a meal allowance, we got an increase in some of the other, in the base salary, some other stipends, but total compensation increased to over 21%. So our PGY ones in 2025 will be making over 100K, which is pretty incredible.
Wow.
And yeah, it's great, but it's definitely still not enough, especially in the Bay Area. And especially cost of living is so high. And I'll just tell you, for comparison, Stanford has fellowships. They call them fellowships for advanced practice providers who are in their first year out of PA or NP school. These are 1-year fellowships, what we would call internships in our world, right? Your first year out of medical school, that's your intern year. And they get paid $190,000 a year for those, which is great. They absolutely deserve it. And it just shows you the market rate for the work that we do.
Yeah, the value. Yeah.
Yeah, we work way more than that, you know what I mean, as interns. And prior to this contract, we were barely scraping 80, you know what I mean?
Wow.
And so there's a long way to go. But I think that was a big victory for our members, was getting those compensation increases. In addition to that, we got better language around lactation accommodations, better language around call room access. We got an expanded fatigue mitigation program. So now any resident or fellow is able to take an Uber home from any Stanford site if they're too tired to drive, which was something that people cared a lot about, because we've had a lot of near misses where people have almost gotten into accidents driving home from, 30-hour shifts. And, with all of those great wins, I think there's a lot that we had to let go. And that's because we didn't go on strike, right? And we didn't, I think, have the power necessary to commit a full-on action like that. There were some things that I really felt strongly about, things like jeopardy pay. So if you're on an elective rotation or on a weekend, day off, you can be jeopardized, called to come in to cover for someone who's sick. And the unfortunate reality is that that's a very easy way for Stanford to cover folks, and people were being jeopardized to cover shifts that were taken off by advanced practice providers, for example, or there would be residents who quit or got fired, and instead of hiring extra residents to bring them on, they would just jeopardize people. And so to me, it seems like they're just over relying on this, what should be a method of last resort. And so we had hoped to have some form of compensation for jeopardy shifts. You get paid a differential, you get paid extra if you get jeopardized. But we weren't able to get that language into the contract. And similarly, there were, other benefits that we were hoping to get that we weren't able to achieve. And I think that's where I encourage everybody who's going through this process to keep the long-term vision in mind and remember that you are building power for the long term. You don't need to change everything overnight. The first step is the most important one. And now we have a much stronger coalition than we ever did. Our membership now, after the contract was signed, is higher than it's ever been. And we're going into the next contract in just 2 years, and we're going to be in a much stronger position than we were right now. Mm-hmm. Exactly. There's one other benefit of unionization that I want to point out that I think is really important, which is having a formalized grievance process, arbitration process, and having access to union representation during disciplinary actions. I think the unfortunate reality, whenever you're in a situation with a really big power imbalance, like there is between us and our attendings, us and our management, there's opportunities for abuse. And I think I've heard many stories from residents who've felt that, who've been mistreated, but for whatever reason haven't felt the courage, because of the power imbalance, haven't felt able to speak up, because their leadership sides with the supervisor who mistreated them, for example. And so having access to counsel, legal counsel, and union representation who can support you if you have a grievance against your supervisor, or who can support you if you're facing disciplinary action, whether it's justified or not justified. That is really, really important to me.
Yeah, no, that's incredible. Thank you for bringing that up because, certainly I did not know that was one of the benefits. What does that look like practically? You mentioned legal counsel, but is that totally a lawyer, truly a lawyer who is available to that resident?
Yeah, so I'll share an example, maybe just to give you a sense of what it would look like. I had a friend who was terminated from a residency program. Just a couple weeks before graduation, they had already gone through their orientation for their fellowship, which they were not able to start because they got terminated for residency. And we don't need to get into the details, but it was a wrongful termination. even Stanford's own internal grievance process pre-unionization found that the termination was unjustified and that there should have been a different disciplinary action. But, this person's career was ruined because of a program director who was, in Stanford's words, quote, acting arbitrary and capriciously, being vindictive, and that person obviously was devastated. They tried to go through Stanford's own internal grievance process prior to the union. So this is saying that I feel like something unfair has happened to me. And I will say the fact that Stanford even had a grievance procedure prior to unionization is unique. Not a lot of hospitals do.
Agreed.
And a lot of places, your only recourse would be to file a lawsuit for an unjust termination.
Right.
But anyway, Stanford had an internal grievance process, but what it looked like is what I'll call essentially a kangaroo court, where this person was expected to represent themselves. They were not allowed to have any counsel present. They couldn't have their own lawyer, in front of a panel of attendings and chief residents who would decide sort of whether this firing was justified or not, or whatever. Which you can imagine is just like an incredibly, like, how powerless must this person have felt? You know what I mean? Being in front of a group of people who have been picked by Stanford leadership, who are going to have natural biases in the case, because they're representing their employer, to have to represent yourself.
Yeah, it literally gives me goosebumps. It kind of makes me nauseous to think about it, but yes.
It's horrible. It's horrible. It's horrible. And, even so, for this person, luckily that group found that the firing was unjustified. But guess what? This person didn't get their job back. Stanford's still appealing their own grievance procedure upward. And so what that would look like now with a union is that person would have access to a union representative in all disciplinary matters. Stanford would not be able to stop them from having a representative with them, right? CIR has legal counsel. They have lawyers who could look at these cases and make some recommendations. You know what I mean? Not that, this person should, if you're going to file suit, then you always want to get your own lawyer too. But being part of a union gives you access to representation in a way that you don't have if you're not unionized. So yeah, for me, that's a really important piece that I think a lot of people don't think about, because it doesn't impact everybody. You know what I mean? I think a lot of us can kind of keep our heads down and get through. But if you're the unlucky person who a vindictive program director targets for whatever reason to make an example of you, whatever it is, having protection is really, really important.
But, I definitely, I will echo, I have seen many terminations from residency just in people I've known over the past years, certainly from my own program and things like that. And I just think that what's such an important point is, like you said, sometimes people hear these stories and they maybe think, that'd never be me. I'm great. Mm-hmm. I work hard and I stay out of trouble and, but I do think that for a lot of us who have witnessed it, been a third party close to or privy to it, it just really does highlight that I don't think that being a good and competent resident, being a kind person, showing up on time, all that stuff, 100% protects you, because it can be so totally arbitrary and, just very subjective in terms of that hierarchical way that historically it's been set up. So I love for there to be actually a due process and not more of a kangaroo court.
Yeah, it's really sad. It's really sad, especially the impact that this person's termination had on my co-residents, and especially the interns at the time, the second years. They were terrified. They were terrified that something like this might happen to them, because this person was respected. They were well-liked. They were a good physician, And so to have this happen, I've had so many people who've talked to me in private about it, just telling me how afraid they are. Oh gosh, my attending told me to go home early and I did, but am I going to get fired now? You know what I mean? It's crazy. It's crazy. But I don't know if that's the point. You know what I mean? If this is a leadership style of leading with fear, maybe that's the point. But the impact that it has is not healthy, in my opinion.
I have seen programs, been adjacent to programs where that is the point. Just even when I was much younger, I was exposed to these departments where every couple of years, every handful of years, a resident would be fired.
Mm-hmm.
And what the co-residents would say about it at the time is, yeah, this happens every few years. They just pick whoever is weakest every few years, maybe like technically, maybe surgically, and that person has got to go. But it's so funny because the way that it was always like discussed, you know, just again, where I'm like a bystander hearing these conversations, overhearing them, the way it was discussed wasn't as if there's just like a true, genuine competency threshold that everyone needs to exceed. It just really was this curve where it was like, the weakest link of all of you could still be a phenomenal surgeon, but we do need to keep everybody absolutely on their toes. So anyway, goodbye to this person.
That's horrible.
I've seen it. And, you know, this leads me to basically my next big question, which is that a common concern that people will voice or accuse to residents who undertake unionization efforts is that it will strain relations between residents and attendings, or residents versus the institution, house staff versus the institution. So what would you say to those who are worried about the negative impacts on relations?
So, you know, I think the relationship between you as a resident, your attending on service, is not going to change at all. You know, people are still going to be focused on patient care. They're going to be you're going to be working hard. You're carrying a busy census. You know, I think my relationship with my attendings was not impacted at all. And I was one of the most active organizers, right? I think for people who are not actively organizing, they're not going to notice any difference whatsoever, because it's not like you're negotiating your contract with your attending ever, even once you have a union. You know what I mean? So your relationship to your attendings in a clinical capacity, I don't think changes at all. You're still going to be focused on patient care and hopefully education. You know, your relationship with the hospital is, as a house staff body, will change. And I think it will change for the better for you. And I think there is some truth to the fact that the hospital leadership might feel uncomfortable, you know? And I'm sorry, but you know, if you feel uncomfortable about the fact that you're working these group of people 80 hours a week and underpaying them, I'm okay with that. You should feel a little bit uncomfortable. If the, you know, GME leadership, I'll give you an example. You know, unfortunately, we have our contract in place now, but Stanford is playing games, and we've had to file over a dozen grievances, nearing 20 grievances against Stanford for a variety of contract violations, that they're not following the collective bargaining agreement that we've already, that we agreed to. That's what we're alleging in our grievances. And, you know, we've heard radio silence. We've been emailing HR and they're not responding to our emails. They're delaying. And this was their tactic during the contract phase as well, is just to try to go slow, let things wear off. Maybe we'll lose energy, not take us seriously. And so we gathered a petition, got over 500 signatures, delivered it to the director of GME, to her office. She wasn't there, so we delivered it to her staff in a very peaceful fashion. And they're all up in arms, you know what I mean, about how, oh my gosh, like this is so, I can't believe you did this. This is so unprofessional. Mind you, this is a federally protected labor action, collecting a petition and peacefully delivering it during lunch on break. But it makes them very uncomfortable. And that's true. That's true. And I think that's a good thing, because the status quo right now, we are bearing the brunt of the discomfort. You know what I mean? We're the ones who are going home after work and crying, or having strains in our marriages, or not spending time with our kids. And so if the hospital leadership start to take a little bit of that discomfort, and if they feel that discomfort because we are starting to advocate for ourselves, that's not something that I'm going to feel bad about, you know? My hope is that program leaderships, like our program directors themselves, who are sort of to the side, you know, because we are negotiating directly with the hospital who employs us, and our program directors lead us educationally, but they're not the people who set our pay and stuff. So what I've noticed at Stanford is that the hospital is trying to isolate program leadership from the residents. You know, they're giving the program leadership misinformation. They're telling them, they're trying to create a culture of fear and trying to chill speech, you know, saying, oh, you can't talk about the union and tell people to vote no. And gosh, the union's going to be so bad for you. My hope is that program directors recognize that this is a vessel for advocacy that we can use to support your job as program leadership. I truly believe that a lot of our program directors, some of the bad actors excluded, but a lot of our program directors truly have the best interests of residents at heart. And I hope that they could recognize that unionization and having a unionized house staff body could be a way for them to ally and to work towards shared interests. Okay, my program director wants to reduce the cap on our medicine service. Maybe we can work together through the union to accomplish that, right? Oh, our program director wants us to have more ability to attend conferences to present research because that will get us better fellowship matches. Maybe we can use the union to advocate for that. And so for me, I hope that our program leadership can see where we can be aligned here. But I won't lie, it's true that the hospital tries to separate and create those internal divisions. That's one of the ways that they try to defeat unionization, is by creating divisiveness and division and saying, oh, you orthopedic surgeons, you don't want to be with those pediatric residents because you guys don't have anything in common. And, oh, the peds people are going to want something different. Oh, you program leadership, you don't want to work with the house staff. But we all have more in common than we do in difference. And so I think, that's a long way of saying that I think it can be a very positive thing, even for program leadership, that you won't notice any difference between yourself and your attendings. And that the only area where you'll notice a difference is that the C-suite are going to start sweating and they're going to be feeling uncomfortable.
Yeah, which I agree. Like, that seems kind of like a fair price.
Totally.
But it's so funny because even when you talk about like, okay, well, maybe ortho versus medicine, it's like, yeah, we're going to pit you two against each other. Like, I would love to take this opportunity to assure everybody that you have more in common with the other house staff than you do with the C-suite. Like, this is just your daily reminder, because I've definitely heard rhetoric that's kind of like, from the house staff level, where the house staff are like, hey, this is a collegiate environment. Like, we're all colleagues here. Everyone stay cool. And it's like, they don't view you as colleagues. Like, I think that words and actions speak pretty loudly from most higher up levels of institutions, as well as, depending on the location, from the attendings. Like, they're telling you and showing you that you're a cog in a wheel, you're a means to an end, and you're very cheap labor for them. And so the other thing that I wanted to mention in response to, delivering that petition to the GME office is that it doesn't surprise me, but it grinds my gears to hear unprofessional lobbied at you guys for that, because because I do think that this is such like a sensitive point. I hate the weaponization of the term quote unquote professional or professionalism at house staff. There's increasing literature on this topic, but it is used pretty often to justify, probation, suspension, termination, particularly against residents who are not white. Or who in some 100%. Way, like, it might even be a resident who just speaks up for themselves in a respectful way, in a reasonable, non-threatening, respectful way. Or like in your case, trainees who do something that is protected by labor laws and is still respectful. It's not, it's not out there. But then for someone to call that behavior unprofessional is such a lazy, fast way for them to try to discredit you or like tear down, house staff. Totally.
I don't even know, like, it's such a vague term, and it basically just means anything that management doesn't like, that's what's unprofessional. Because I will tell you that in my opinion, a lot of the behavior that Stanford exhibited during our contract negotiations, if we had done, would be considered extremely unprofessional. Not responding to emails, delaying, showing up late, being rude. That's the type of stuff that if we do on rounds, if I did that to a patient, I'd be slapped with professionalism so hard, but yeah, it's a weapon that only points one way. You know what I mean?
I know. So I just think we got to call that out when we see it and everything. I have two more questions left for you. This is kind of our last big, unionization topic. And it's just because I see this question come up commonly all the time. So if people haven't gotten this question answered elsewhere, what would you say to those people who are worried that unionizing will affect their case numbers, their quality of education, and their adequate training hours?
So, the union is whatever you make of it, right? You get to choose what you negotiate over. You get to choose what you bargain for. this was something that a lot of our surgeons were worried about, right? That they, for a lot of reasons, feel like it's already hard to get the number of cases that they needed, that they didn't want to touch work hours. And so we didn't, we didn't. We didn't make any restrictions to our work hours. There's nothing that changes the quality of their training in terms of the amount of time that they're working, right? So what I would say to those people is that you should get involved, and whether or not you want to actively organize for the unionization effort at your hospital, you should at least talk to the people who do, because they're going to be representing you, and you should tell them what your interests are. And I think that those people will respect your interests, right? So that's the great part about unionization, is that it's hyper local, and it will be directly, right? This isn't a policy that's happening nationwide. This is going to be for your hospital. And it can be very granular. There can be different things for different departments if you spell them out in the bargaining agreement. So if you get involved, you can shape your hospital to look however you want. One of our CIR shops is a family medicine only residency, and they negotiated reduced work hours because that's what they wanted, and they didn't have any surgical folks or people who needed procedures that were worried about it. But at Stanford, we have a lot of proceduralists, a lot of subspecialists, and that wasn't something that they wanted to negotiate for. And so we didn't. So, that's the good thing, is that it can be very responsive to what the needs are of the people there.
That's wonderful. Okay, perfect. I mean, Again, I'm sold. You've convinced me.
Everybody should do their own research and their own thinking. I encourage people to pursue every avenue that they can to make the lives of their fellow humans better. I think that the good thing about unionization is that it is the federally protected form of collective action in the workplace. And if we're not using that tool, what are we doing? That's what it is for me. If there were a better and easier way to do things, I'd be open to listening to it. But this is what we've got in the US, and it can be very effective. And so I think that we would be fools not to take advantage of it.
Agreed. So I like to ask everybody, do you believe in karma?
That's an interesting question. Do I believe in karma? I think the sort of philosophy of karma to me is that actions have consequences. You know what I mean? And I definitely believe that. I believe that, and I think that sort of part of it is that, like, the intention that you set, the way that you choose to go about the world, will influence you internally. I don't necessarily believe that there's something divine that's going to change in that karmic sense. You know what I mean? Mm-hmm. But I do think that, actions have consequences, and that the way that you go through the world will impact the way that you receive the world. And in that sense, I guess you could say I believe in karma.
Wow. I love that. Very deep. Well, thank you again for joining me today. It's been such a pleasure to chat with you and learn from you about this incredibly important topic.
Thanks so much for having me, and thanks for everything that you're doing as well. It's really heartening to see when folks who've completed training continue to advocate for those who are still going through it. So thank you.
Next week, we will have Dr. Joni Lathan, a med-peds attending physician in academia, joining us to discuss the hidden curriculum of medical training. Follow me on Instagram at francismay.md and at Rethinking Residency. Visit my website, rethinkingresidency.com, to learn more about resident physician stories and ways that residents can most effectively navigate the game of residency. I cannot wait to connect with you on the next episode of Promising Young Surgeon.